right. Hello, welcome everyone. We've got our Facebook Live, Instagram Live event happening tonight. So I am Sarah Brice and I am the VP of Business Development for Cliovana, which I know that you guys have been hearing through my Instagram page. And I'm sitting here with Dr. George Branning with Texas Gynecology.
Good evening, how are you?
And he is our newest Cliovana practitioner that is located in Frisco, Texas. So we are so excited to have you on board.
Oh, it's my pleasure. I've been waiting for this. I've been waiting for your data to get 12 months so I could see that it was just as good in the second half of the year as it was at the beginning and then your original data. And it is, it's fantastic.
So tell us, because I've been talking to you for a while through COVID. That was strange. Tell us what made you bring this in. I mean, you were an OBGYN, but no longer doing OB, just GYN.
Correct.
So what sort of triggered you to bring this in?
So stopped doing OB about 2 years ago, really so I could spend time doing this part of women's care, and that is hormone therapy and sexual therapy and functional medicine for women. We're Texas Gynecology, but we're also Texas Hormone and Sexual Wellness. It's a very, very important part of a woman's life that I think what I found was that as we did this, women were very appreciative because they finally found someone who would sit down and have a conversation with them. And that's what I like the most about my job now, is I can actually have time to have a conversation with women. What I hear over and over again is about sexual dysfunction. And so that's why we brought in hormone therapy, because testosterone, being the dominant hormone in a woman's life, is rarely addressed. Now it is being addressed better and better. That helps with libido, that helps with that. And that brings on more of trying to fine tune their sexual wellness. And so we do laser therapy for vaginal function, and we happen to use the Cyton Diva.
Okay.
And we also did the PRP injections, and they're okay, but they're kind of hit or miss.
Okay.
I like them for the incontinence part of it, but I was looking for something that really helped a woman with her orgasmic potential.
Sure.
And that's the complaint I hear most often, is that I'm not having as many orgasms as I did when I was younger, or that they are not as intense as they were.
And so give us a little bit of, just for the people that are listening that don't have a lot of medical background, tell us why that is. Why do women in their 50s, 60s, 70s experience that lack of blood flow and just the inability to really have an orgasm like they would in their 30s or 20s?
I mean, it's kind of complicated. I mean, the largest sexual organ in a woman is right here.
Yeah.
Men a little further south. So that's easier to explain. But I think that a lot of things happen. And first of all, hormonally, you have to understand, while a man loses his testosterone just gradually as the years go, so does a woman. But all of a sudden in menopause, it drops off. And so she's lost testosterone, estradiol, and progesterone all at once. And so there's this big change that occurs in menopause. But even before that, we're seeing problems. To try to be as non-technical while being technical, the clitoris and the penis both are homologous. They depend on blood flow. And what happens with men with ED oftentimes is a decrease in blood flow. Oftentimes it is debris that accumulates in the vascular, larger than you think it is. And it's homologous, in meaning that it's the same tissue from the embryo that makes the clitoris, that makes the penis. And so when blood flow is restricted in the clitoris, you're not going to get function. You're not going to get erectile function. You're not going to get stimulatory function. You're not going to get orgasmic function. And then that feeds the largest sexual organ, and you have just this kind of big circle. So we try to hit this from all sides. Hormonally for libido, good counseling, testimonials from other women who've gone through this, and then try to treat it functionally as well, and both with the Diva and now with the Cliovana, which I'm just kind of blown away by, quite frankly.
Okay, so let's go into that a little bit. So you've had it now for what, 6 weeks?
6 weeks.
Okay.
I've been talking to colleagues though who've had it, so
Okay.
yep.
And so tell me your initial just sort of experience with the first, couple of patients that you treated.
Yeah, so the treatment's 4 treatments, 2 a week for 2 weeks. But the first patient I treated was treated one time. It was basically to see, it was to teach us how to use the machine.
Sure.
And that one treatment was pretty impressive for this patient. And then you go fast forward to the patients we were able to give full treatments for. I think the best way to explain that is to just quote some of their responses to what has been happening to them.
Yeah.
And you hear things like, I'm feeling sex in a part of my vagina I never knew existed before.
Wow.
I'm having orgasms from the sides of my vagina. I never knew you could do that.
Wow.
My oh my God sex has returned. And so when you see that, and then following up weeks and weeks later, the first patient we treated, I still am in contact with her and I ask her all the time, how are you doing? And it's still the same. It's still as intense. It's lasting longer. There's more potential for multiple orgasms. So I see this replacing my PRP injection.
Wow. I mean, that's a pretty strong statement. So, and that's the one thing that I would say overall we hear, what you're telling us is not a surprise because we do hear that a lot. And it's something that, for patients and as for women, I feel like the biggest thing is just getting over the hump of that taboo, can I talk about it? And just to bring up a good point with you, if you're going into your OBGYN, typically they don't have time. They're not asking women about their sexual health. They don't have the time to. And so there's not many practices like yours that sort of take in the whole thing, right? You're looking at the cockpit and going, okay, there's lots of buttons here for women. Like men have that one big easy button. For us, it's like this cockpit of just all kinds of stuff. And you're sort of bringing in everything that you need to address whatever issues they have within that cockpit. And I think that's, we don't see that very often.
I knew that if I was really going to be helping women sexually, I had to have Cliovana. It was the arrow in my quiver that it had to be there. And you're right, it starts with a conversation. And for some reason, I just must have the face that they can tell everything because they tell me everything. It's like I must be the best bartender there is because they just tell me everything. And that's where it starts, having that conversation, taking the time that I didn't have as much of when I was an OB.
Yeah.
And so this is fantastic. I love going to work because I have time to spend with my patients. And so many patients want to have that conversation. And when they feel comfortable, and then when they tell their friends and they tell their family, here's a practice where you can come to and you can be open and honest about your sexuality and your issues with sexuality. And Dr. Branning and his staff actually may have a therapy for that or a cure for that or a message that may help you get through this. Because you're right, there's a lot of moving pieces on the female orgasm, and so much of it we have to help fix the libido, which sits up here. Mm-hmm. And it starts with permission, not that I'm giving anyone permission, but they're giving themselves permission to talk about their sexuality.
Yeah, no, I agree. And the things that we always hear, there's segments, and with COVID, I feel like it even brought these issues up even more because people were at home, they're having lots of sex. We see all these like COVID babies that are starting to pop up. My Instagram feed is full of babies that are coming like in December and January, mm-hmm. which is funny. But it's brought up all of these issues where women are like, okay, yeah, we're having sex, but it's not really great sex. So what can we do? Do I have to sort of just suffer through that? And the answer is no. And it's very empowering for women. It's a really empowering thing for women to say, you know what, I can satisfy myself. And I think it's important for us as practitioners to educate women that you should know what feels good within your body. And you should be able to explore that on your own, because how can you expect someone else to pleasure you when you don't know how to do it yourself? And that's what I love about Cliovana. I love that we're really empowering women, but there's also this really important education component for women that are in their 20s to their 80s. Sex doesn't have to stop just because you hit a certain age. Mm-hmm. In fact, it should only get better. And I was talking to a doctor the other day that said, my goal is to really add years to their life, but life to their years. And it's so true. That's exactly what you're doing. And then you end up seeing men from this, right?
Correct. And to your point, I think it's important to let women know that masturbation is perfectly normal and okay. Matter of fact, we encourage it after Cliovana. We want them to have as many orgasms or as many, you would, in a man you say an erection, but as many sexual acts as they can after Cliovana.
Yeah.
So we saw this when we started doing hormone therapy, and we're starting to see this again now, that as you enhance the woman's sexuality and she begins running circles around her husband or her partner, he's looking for that same issue. Now, this isn't going to necessarily be for him yet. We do have some hope that this can help with male ED.
Yeah.
But it brings them in for the hormonal therapy. And then we all have a conversation. I want to tell you something that was so impactful for me yesterday. There's a family that I've taken care of for a long, long time. I've delivered all their babies. I'm a Longhorn, she's an Aggie, he's a Longhorn, so we have this funny kind of thing going on. And she's been a patient of mine for a long time in hormone therapy and sexuality therapy. We've done Diva for her, and she's interested in Cliovana. He came in for labs the other day because he's also a patient of mine. And he stopped me and he said, "Hey, listen, what you do for Stephanie is amazing. And I'm so glad that she's found you and this practice, because I really love living with her. And I really love being her husband. And now you're letting me be the husband that she wants as well." I mean, it's what it's all about. It's kind of what it's all about.
That's amazing.
And sexuality is so important. We know the statistics that people who have a rich sex life, people who are married in a happy marriage, live longer.
Yeah.
It's that important. And I'm glad to finally have found kind of my niche post-baby, that I can help and be more impactful on as many people, men and women, as we can.
I mean, it really is like saving marriages. I mean, you're
Clearly.
saving marriages.
And again, I'm not trying to break my elbow to pat myself on the back, but it does. And we get thank you notes all the time. We get notes from second honeymoons. We get things like that.
Well, you can just look at your reviews. And if anyone is here in the DFW area, I would encourage you to go online and look at Dr. Branning's website and the reviews. You have the most incredible reviews that I've ever seen.
We're very proud of them, and we're aware of them, and we are amazed, and we're very, very blessed. Honestly, I think it reflects that I like what I do,
Mm-hmm.
and that I have a great staff. It's probably more my staff, but it's wonderful, and I think it really does, Sarah, show that we have found kind of our stride in this part of our practice.
Yeah, no, I think so too. I mean, you guys are definitely onto something that's going to be really exciting, and it's going to just take off, I can tell. And you have been an amazing practitioner to work with. So it's no surprise at all why those reviews are there, because the more I get to know you, we're just like friends now.
Yep.
Good old friends.
Absolutely. To talk about sex.
That's right. Talk all about our orgasms. So, well, good. Well, this has been really great and informative, and I feel like there's a lot of women out there that do have questions, that want to come out and talk to someone that really understands, and in a place where you can get all of the different things done. So whatever it is that they're needing, it's kind of like the one-stop shop.
Correct.
And it's important too that their husbands can come in, because most men aren't going to walk into an OBGYN's office, and when they're here, you're treating the couple. I mean, really, and that's what you're able to do, which is fantastic.
Well, we have a saying here that we're their gynecologist, GUI, so we take care of the guys as well.
I love that.
Yeah.
You better coin that, because now it's live and it's someone's going to steal it.
We have. No, we already have.
Good.
So.
Great. Well, this was awesome. I'm so excited, and it is Sextember month, so it's the National Sexual Awareness Month. And we want to encourage everyone out there, men and women, to really make your sexual health a priority and know how to please yourself, and know when it's time to get help doing so, because after all, pleasure is probably one of the best things in our whole life. I mean,
thinking so. Yeah, I'm a fan.
I'm a fan. Good. All right. Thank you, Dr. Branning.
Thanks, Sarah.
It's great, guys. Thanks.